Every week, there's a new doctor online explaining why they quit. AI is coming for their job. Burnout is at an all-time high. The system is broken. So before you spend a decade training for a career in medicine, it's worth asking, is there any reason to actually be optimistic? Turns out, yes, but not everywhere. Dr. Jubal, MedSchoolInsiders.com. In 2026, physicians across 29 specialties were asked to rate their specialty's long-term future. Most weren't feeling it. 25 of those 29 specialties had fewer than half their doctors saying they were optimistic. But not all doctor career paths were so bleak. These are the most optimistic doctor specialties. 2 specialties tied at 5th with 49% optimism, and they're here for different reasons. Neurologists diagnose and treat disorders of the brain, spinal cord, and nervous system. Demand is rising alongside an aging population, and the field has seen significant advances in treatment in recent years, giving physicians more options than they had a decade ago. Preventive medicine physicians focus on keeping people healthy before they ever get sick. It's an emerging field gaining real momentum as patients and health systems increasingly prioritize prevention over treatment. Longevity medicine, lifestyle medicine, population health, the cultural moment is moving in this direction. ENT physicians treat conditions of the ears, nose, and throat, as well as structures of the head and neck. The specialty consistently ranks at the lower end of burnout among surgical fields at 43%. Compensation averages over $520,000 annually. The work is procedurally rich, outcomes are generally positive, and the hands-on surgical nature of ENT offers real insulation from automation concerns. Plastic surgeons restore and reconstruct tissue from trauma repair to cosmetic procedures. The specialty has the lowest burnout rate in medicine at 37%, with average compensation of over $620,000. There are 2 types of plastic surgery: reconstructive, which restores form and function after injury, illness, or congenital abnormalities, and aesthetic, which enhances appearance in otherwise healthy patients. Aesthetic is elective and cash pay, which means less insurance friction and more control over how you run your career. The tactile judgment and aesthetic sensibility this work demands aren't things a machine picks up easily. You're working with your hands in a meticulous way, something not easily replicated by AI, at least not yet. Psychiatrists diagnose and treat mental health conditions ranging from anxiety and depression to schizophrenia and bipolar disorder. The AI conversation in mental health is real. Tools are multiplying, and some researchers have raised serious questions about where AI is headed in psychiatric diagnosis. And yet, psychiatrists themselves are reporting optimism, which is worth paying attention to. A few things may explain it. Mental health demand has grown substantially, and the provider shortage remains severe. Whatever AI is doing at the margins, it hasn't closed that gap. Patients still want a human across from them, and the legal and clinical liability of unsupervised AI in high-stakes mental health settings remains unresolved. That said, recent research suggests AI can emulate empathy and human connection more effectively than most people expect, which means the long-term picture is less settled than psychiatrists may think. Oncologists treat cancer, managing chemotherapy, immunotherapy, targeted therapies, and the full arc of a patient's care through one of medicine's most serious diagnoses. At 70%, they're not just the most optimistic specialty in the survey, they're the most optimistic specialty by a 13-point margin, with psychiatry trailing in second place at 57%. Cancer cases in North America are projected to increase 56% between 2022 and 2050. The oncologist shortage already exceeds 2,000 physicians, and only 14.5% of practicing oncologists are under the age of 40. One oncologist surveyed described it simply: demand will increase with an aging population, and the shortage is particularly acute in rural areas. As for AI, oncologists aren't worried. They're welcoming it. From imaging interpretation to documentation to treatment planning, AI is giving an already overwhelmed field more capacity to meet a demand that isn't slowing down. If you want the full picture of what a career in oncology actually looks like, including the day-to-day of the career, click up here. Or watch this video to learn how AI is completely transforming medical school admissions. It's getting harder, and you need to know how to adapt.